Welcome to this episode of Youth Diary. Today we have Dr. Anish, who is a dermatologist with Kaya Clinic. So welcome to the show, doctor.
Thank you.
Well, today we're going to discuss the most common problem of any youth, you can say, because we're going to talk about skin, tanning, acne. I'm sure we have a lot of viewers this week for this particular show. Doctor, I would like to ask you the question regarding acne problems. Is it because of the eating habits of today's generation, or what is actually the reason behind?
Well, I'd like to begin by saying that we're beginning off the session with one of the most common conditions that we as dermatologists encounter in our practice, acne, which is more of a youth problem, as you were rightly mentioning. Now, what is acne exactly? Acne is a result of obstruction of the pores of your skin where it produces oil. Okay, the oil-prone sites of your body, like your face, your chest, your upper back, these are the sites where you get acne. And what results in acne? Not just the obstruction and the inflammation, but there is a super-added bacterial colonization that happens, a hormonal stimulation that happens, and all these together, an entire foray of things contribute to the manifestations of acne, which include the blackheads, the whiteheads, the pimples that you call, the pustules, nodules, cysts, and even scars. So acne per se is a physiological variation of a normal physiological process, but because of the disfigurement that it causes, you have to regard it as more of a disease. Now, the question that you asked is regarding the eating habits and its contribution to flaring up of acne. Now, a number of studies have been conducted in relation to identify a correlation between the dietary habits of people and acne, and more or less we rely on personal experiences, anecdotal reports which don't have a solid backup of scientific study. When people coming to your clinic tell you that eating chocolates exaggerate their acne, eating nuts exaggerate their acne, or eating egg exaggerates their acne. But there are few food items which have a scientific correlation in terms of exacerbating the disease, and that includes dairy products, which includes milk, and those foods with a high glycemic index. Now, glycemic index is a figure which indicates how much a particular food item can increase your blood sugar, and that includes refined carbohydrates. And put it in very simple terms, the more westernized your diet is, the more prone it becomes to acne. Okay, so the more pizzas and hamburgers that you take, the more colas, the more Pepsis, that becomes a more acne-prone diet. So my advice to the youth would be to cut down on all that junk food, the bakery food.
Yeah, you can't really completely avoid it, so cut down on it.
No way, you'll have a school get-together tomorrow at Pizza Hut, what will you do? So obviously, you can't cut down totally on these food, but that is what you need to focus on if you're trying to control acne in terms of your dietary habits.
The next question is this.
Hello, my name is Vishnu. I am from KME Engineering College. I have a doubt for you, doctor. What are the adverse effects of hair dyes?
Hair dyes. Now, hair dyes are very commonly used cosmetic, not just among the people who are, of the graying hair age group, also among the youth of today, where premature graying is becoming more rampant, mostly related to genetic issues. But premature graying is one situation where the youth also depend on the use of hair dyes, not just for cosmetic coloring of the hair, but also for reasons of premature graying. When an Indian ages or grays his hair before the age of 30, it means he has premature graying. And one of the ways to counter that is cosmetic camouflage in the form of hair dyes. It's a very difficult condition to actually treat, although you can supplement some agents like PABA or calcium pantothenate. It's very difficult to control. So the best thing to do is go for a cosmetic camouflage, and the best thing to do is to use hair dyes. And what are the adverse effects of hair dyes? Now, adverse effects of hair dyes are mostly related to the components of the hair dye itself. Now, the most common encounter that we have with someone using a hair dye is an allergic contact dermatitis, that the person has developed an allergy to one of the components of the hair dye. And the most important component which is responsible for this is what we call the PPD, or the paraphenylene diamine. Now, paraphenylene diamine in the hair dye is the most important culprit to cause an allergy to the same, and hence there are a number of dyes available in the market today which are PPD free. It's specifically written on the label PPD free. So I would advise everyone to go for the PPD free dyes so that you don't get an allergy to it. And the other thing is, what kind of damage does it do to the structural integrity of your hair? And some of the components, like example ammonia, which is actually used in the hair dye to penetrate the cuticle so that the dye gets into the hair. What this does in the long run is it affects or tampers with the normal structural integrity or the physiological structure of the hair. So in the long term, it can cause thinning of the hair, fragility, and even can lead on to breakage and hair fall. So the another content of the dye that you need to be aware about is the ammonia. So what we have in the market today, we have a lot of products. We have products with ammonia-free, PPD-free. So in terms of efficacy, these dyes which are ammonia-free, which are PPD-free, might be lesser in terms of, the normal hair dye. But then you better be safe than sorry. Why damage your hair? Even if the dyeing effect is a little less, I think it's better to go for a dye which is PP and ammonia-free. And we also have vegetable oil-based dyes, which that is also available. So I think people should go more for chemical-free, safer hair dyes should be the option. These are some of the adverse effects that can happen, and you need to be aware of it.